Welcome back. Today is part 2 of a Hyperdilute Radiesse treatment for this patient. Last week you may have watched her temple treatment, and today we are working on her face with Dilute Radiesse. They consider Hyperdilute Radiesse to be anything greater than 1:1. Meaning 1 part diluent to 1 part radiesse. And in this particular case, we are treating her with 1:1. So they consider that dilute radiesse rather than hyperdilute radiesse. Hyperdilute radiesse would be anything greater than that. So 1:2, 1:3, and so on. So today is part 2. And we are going to take a look at the right side of her face, but be sure to stay till the very end if you would like to see the other side of her face. There will be complete video, uncut, so that you'll be able to see the full treatment. Just be sure to stay to the end for us. So we are going to start here. The patient has already been prepped using HibaCleanse and alcohol to ensure that she is nice and clean. And again, we're using 1:1 ratio for this dilute radiesse. That means for every 1 syringe of radiesse, I am using 1.5 cc's of saline as my diluent. We used Radiesse Plus in this patient, which means there's already lidocaine, and so we only used saline for the diluent portion. And we used 2 syringes total for her face. So in total, I had 3 cc's of saline to 2 syringes of radiesse, because radiesse is 1.5 cc's in total. And we have blended it together nicely, just as it is recommended, and we will teach you to do once you come to a biostimulatory course with the AAFE. And now we are just fanning the material. So dilute radiesse is all about distributing the product evenly in your treatment area with very even retrograde fashion of placing that radiesse in a fanning approach. So you can see here we're just sort of entering in and out with the cannula and fanning the material in a retrograded fashion to make sure that she has a nice even spread of the dilute radiesse in her treatment area. So overall, this patient is very young. However, she's lost a lot of volume. In terms of her metabolism, she could pretty much get cheek filler every couple of months. She eats through filler very quickly. And so therefore we decided to try Hyperdilute Radiesse and see if we could restore more of her collagen and elastin for a longer period of time rather than constantly needing to restore volume in the cheek and mid-face. So we are using the biostimulatory filler at this point in the radiesse in order to stimulate collagen and elastin to try and fill in these areas where she appears like she's lost some volume. So in the cheeks, in the mid-face, in the jawline, overall we're looking for nice refreshing appearance of the area, and hopefully we're hoping to get more volume out of this. When you're looking to restore volume in a patient, you want to use a 1:1 ratio. If you are treating a patient for more of textural concerns such as acne scarring, you might consider having more diluent, so maybe like a 1:2. We usually use 1:3 in the neck because we are just trying to help with overall textural appearance and the appearance of the skin rather than achieving volume. So if you think about using less diluent, you're getting still a little bit of that volumization with your radiesse, but you also get the biostimulation as well. So we're just trying to pop back into our plane here. Sometimes when you pop out with your cannula, it's harder to get back in. But once you get back in, we're just going to continue to fan the material. Sometimes it requires going back in with your pilot needle, which is completely acceptable. And then away you go. So in this treatment, we are looking to be immediately subdermal. And so you can see that once you get in and out of that plane, generally speaking, you can sort of glide in and out pretty easily to do the fanning of the product. Okay, we are going to move on to treatment of the upper face. So we've created essentially two entry points, in the lower face and one in the upper face. And we're looking to just fan your product so that you're getting equal coverage all across the face. For this particular patient, we're looking for essentially global improvement. And so I want to make sure I have nice equal coverage of my cheek, my mid face, and my lower face. And so now we have entered along the zygoma with our Dilute Radiesse, again, a 1-to-1 ratio. And we're just going to fan this material into the treatment area to make sure that we're going to stimulate really good collagen, get a nice good collagen response. And so we are going to just, again, enter in through our one entry point and fan the material out. So that way you get a nice treatment and a nice response of that neocollagenesis. You can see the treatment is fairly comfortable for this patient. Again, there is lidocaine in the radiesse, and then I used lidocaine to numb that entry point as well. So of course, anytime with a cannula, occasionally you can experience a little bit of pinchy areas, maybe coming through ligaments or pseudoligaments, but overall the procedure is fairly comfortable for the patient. You can see she's doing quite well. And we're maintaining that immediate subdermal plane to place the radiesse. Always in a retrograde fashion is the only time that you're injecting is on the way out. This treatment is a really, really great option for those not only who have lost volume, but who have issues with textural concerns such as acne, scarring, irregular texture and tone, and it's excellent for fine lines and wrinkles as well. Of course, your ratio for diluent to radiesse will change depending on what the concerns are and what you're looking to accomplish, but overall, there's just a wide variety of things that you can do with this dilute or hyperdilute radiesse treatment, depending on how you choose to dilute it and what your treatment approach is. That's the beauty of aesthetics, is that every patient requires a different treatment plan because we all have varying anatomy and our goals are different and our deficits are different. And so, the Hyperdilute Radiesse really allows a lot of flexibility for you to create a treatment plan that you think will best address the patient's concerns. And for this particular patient, overall, she is needing stimulation of some collagen throughout her entire face, both upper and lower. Despite her being young, she has lost a fair amount of volume. And so we hope to restore volume and slow those signs of aging over time. So again, we're going to continue fanning this product in, and then she'll be done. We'll give her a nice gentle massage when her treatment is finished, just to make sure that the product is nicely integrated. And that's all. The patient is not required to do any form of massage after the treatment, unlike some other biostimulatory products. Other than our massage post-treatment, she is not required to do any massage moving forward, which is great. Patient compliance can be a challenge if it's requiring a lot of massage or things like that post-treatment. And so for this, she doesn't have to worry about any of that. We'll just give her a nice gentle massage, and then we'll see her back in about 4 to 6 weeks for her third and final treatment. And we can't wait to show you those results. Don't forget, stay tuned all the way till the end of the video, so that way you can see treatment of the other side of her face as well. Thanks so much for watching.